once again. As said, we have spoken about so many topics up until now, right? So today, what next? We will be speaking about homeopathic theraps for lymphadenopathy. कई बार आपको ये क्वेश्चन आता है, व्हाट आर द होम्योपैथिक मैनेजमेंट फॉर सर्वाइकल lymphadenopathy या डिस्क्राइब ड्रग्स फॉर lymph node enlargement या सर्वाइकल lymph node enlargement या axillary lymph node enlargement. सो हाउ आर यू गोइंग टू डिस्क्राइब द मैनेजमेंट? ओके, मैनेजमेंट के आपको पता है ना क्या क्या 3 पॉइंट्स रहते हैं. यू हैव टू राइट डाउन व्हाट इज कंजर्वेटिव लाइन ऑफ मैनेजमेंट, व्हाट इज मेडिसिनल लाइन ऑफ मैनेजमेंट जिसमें एलोपैथी एंड होम्योपैथी आता है, एंड व्हाट इज सर्जिकल लाइन ऑफ मैनेजमेंट, दैट इज सर्जरी का क्राइटेरिया कब आता है. In medicinal line of management, you need to understand that allopathy, I am not going to talk about. Homeopathy may you have something called as acutes, you have specifics, and you have constitutional remedies. So today I will be speaking bits about everything. I hope you have patience to write down all the notes that I am going to describe and tell you. Okay, first and foremost, when you are selecting or when you are writing drugs, ओके हर एक ड्रग्स, जैसे आपको मैंने पहली कई वीडियोस में बता चुकी हूँ मैं ये कि आपको ड्रग डिफरेंशिएशन करते हैं तो उसके हर एक ड्रग के ना कुछ पीक्यूआरएस पेशेंट में पिकअप करने हैं. तो अगर आप कोई लिम्फ नोड एनलार्जमेंट वाला पेशेंट देख रहे हो तो व्हाट आर द इम्पोर्टेंट पॉइंट्स दैट यू हैव टू कैच होल्ड ऑफ एंड यू हैव टू राइट डाउन. सेम पॉइंट्स को आपको हर एक ड्रग में ना डिफरेंशिएट करते जाना, बहुत ईजी हो जाएगा. फर्स्ट इज उसका एलिमेंट्स फ्रॉम क्या है, मतलब वो पर्टिकुलर ड्रग की एलिमेंट्स फ्रॉम की अफिनिटी कौन सी है, देन साइड अफिनिटी कौन सी है, देन वो थर्मली हॉट है, चिली है, देन उसका ओडीपी कैसे, सडन ऑनसेट है, ग्रेजुअल ऑनसेट है, सडन प्रोग्रेस है, वगैरह वगैरह. देन इज इट अ डिस्चार्जिंग और सप्यूरेटिंग रेमेडी, इफ सो व्हाट काइंड ऑफ द डिस्चार्जेस डज दैट पर्टिकुलर ड्रग प्रोड्यूस, ये भी आपको वहां पे लिखना है. देन उसके मोडालिटीज क्या क्या है, राइट उसके पीक्यूआरएस मोडालिटीज, मतलब बेटर बाय वार्मथ है, वर्स बाय कोल्ड है या वर्स बाय वार्मथ है, सो ऑन एंड सो फोर्थ. ठीक है, ये डिफरेंशिएशन हो गया. देन यू हैव टू डिस्क्राइब वो पर्टिकुलर ड्रग में अभी वो जो लिम्फ नोड एनलार्जमेंट है, वो जो स्वेलिंग है, हाउ इज दैट स्वेलिंग, इज इट सॉफ्ट, इज इट मोबाइल, इज इट गोइंग टू बी वेरी हार्ड, इज इट गोइंग टू बी वेरी इंड्यूरेटिव. हर एक ड्रग का ना एक एक टेंडेंसी होता है. अभी जो बेलाडोना की टेंडेंसी रहेगी वहां पे आपको बेलाडोना ही देना पड़ेगा, साइलिशा आप वहां पे नहीं दोगे. अभी जहाँ पे साइलिशा देना है वहां पे साइलिशा ही दोगे, वहां पे कोई और दूसरी रेमेडी दोगे नहीं, बिकॉज हर एक ड्रग की एक टेंडेंसी है. ठीक है, वैसे वो पर्टिकुलर ड्रग की टेंडेंसी टू मेक दैट पर्टिकुलर स्वेलिंग क्या है ये देखना है आपको. ठीक है, तो ये पॉइंट्स ही आप अगर डिस्क्राइब कर दो ना तो बहुत ईजी हो जाता है आपको थेरेप्स लिखना. सही बात है. ओके, so now we talk about what are the commonly spoken of drugs for cervical lymphadenopathy या lymph node enlargement. Write it down. First we are going to start with belladonna. You have Parsulf, you have Moxol, you have Silesia, you have Phytolacca, then you have iodum, you have tuberculinum, you have Calcaria carb, you have Baryta carb, you have Konam, you have Calcaria fluor, and many more other drugs, right? Even Calcaria carb is there, even Carbo animalis is there. But today I'm going to start with very few drugs जो आपको commonly practice में use आप कर सकते हो. अच्छा, अभी जो मकसद है आपको थेरेप्स नरेट करने का वो सिर्फ एग्जाम के ओरिएंटेशन में नहीं है. मतलब yes, एग्जाम में you'll be able to write it nicely, but in case if you are a third year student और a fourth year student or an intern, you see to it that ये थेरेप्स देख के ना आप वो ड्रग्स आपके पास रखो, वो टोटलिटी मिलती है तो वो प्रिस्क्राइब भी कर दो. इससे होगा क्या, यू विल बी एबल टू इजीली अंडरस्टैंड कि कोनाम कहाँ पे काम आता है, बेलाडोना कहाँ पे काम आता है और साइलिशा कहाँ पे काम आता है. समझ में आया? ओके, सो वी स्टार्ट विथ बेलाडोना, राइट. सो बेलाडोना का एलिमेंट्स फ्रॉम क्या है, जैसे मैंने पहले बोला, इट हैज एलिमेंट्स फ्रॉम हेयर कटिंग, सन, walking in wind or draft, right? इसमें again, what do you see? It has sudden and violent onset. There is dryness, there is bright redness, there is burning heat and great pain. ये बेलाडोना का PQRS है. Swelling of an inflammatory character. Now mind you, this is only inflammatory. यहाँ पे suppurative tendency है नहीं in बेलाडोना, but the swelling will threaten suppuration. मतलब it is not a well formed pus, but however it might land up into that zone. Then swollen glands in the axillary nodes, especially at the climaxes, or swelling of mammae which are heavy and red and sensitive, red shiny streaks radiating from glands with great thirst and stitching pains, swelling, suppurations and indurations of inguinal and cervical glands when the attack is acute or painful. Now, side affinity, it is right-sided drug. You will see a red face with throbbing carotids and the patient is sleepy but cannot sleep. Pain comes suddenly and they go suddenly. The pains are throbbing in this case, जो बेलाडोना का PQRS है, sharp shooting and cutting pains are there. Okay, now this patient is absolutely sensitive to draft. मतलब इसका aggravation is with draft, with draft on head or heat of sun, or after taking cold, and better with bending backwards, semi-erect position, and leaning against something. Right? Now this is what Beladona is all about. समझ में आया? Now we move to silesia. Abhi silesia is not just inflammatory. You will see silesia to be used in this swellings which are even suppurative. So inflammatory का we have taken only one Beladona as drug. कई सारे ड्रग्स हो सकते हैं पर मैंने सिर्फ यहाँ पे बेलाडोना पिकअप किया. ओके, साइलिशिया के एलिमेंट्स फ्रॉम क्या है? एलिमेंट्स फ्रॉम वैक्सीनेशन, लॉस ऑफ फ्लूइड्स, इंजुरीज. यहाँ पे मतलब इंजुरी कुड बी एनीथिंग, एनी prick injury, any pin injury, anything that goes into the particular part, or strain of foreign bodies which have gone, or splinters which have gone. ठीक है? How is the appearance of the patient? Cachectic, senile and scrofulorachitic diathesis. मतलब lean thin रहेगा with a tendency to affect to any bone elements or tendency to have any glandular elements. Okay, people with large head, with wasted body and fair clear complexion. अभी now यहाँ पे PQRS क्या मिलेगा आपको? The individual will again be keenly sensitive just like it was in Beladona. However, ये individual आपको बहुत chilly मिलेगा. Chilly to the extent that this individual will be seen to be holding or hugging something which is very warm or this too. Now यहाँ पे आपको यूजुअली malnourished individuals रहते हैं बच्चों में, अगर है तो, with arrested developments and swollen glands or glandular diseases the individual might come up with. So the pains again here are violent and stitching. But what is the again difference यहाँ पे? What do you see? It is slow, incomplete processes and then indurations. Every hurt festers. Festers मतलब every hurt, every injury which is happening over there might suppurate. Stubborn suppurations, fistulae will be there, abscess and proud flesh. Indurations, cicatrices are there. And then you will have this individual with foul discharges and coldness of painful parts, and he's worse with cold, so he'll want anything that is warm to be wrapped up. Okay, यहाँ पे you will encounter a lot of indurations happening. Fistulae will be seen out over here after the suppurations also, which are not treated at the right time. Calcaria fluid again is a commonly encountered or commonly given remedy for fractures or for any kind of glandular complaints as specific, right? So it has what elements from fractures, post-operative ascending and lifting. Now this individual will be having indurations which are stony hard. अभी hardness आपको कैसे दिख रहा है? ये hard है, ये hard है, कैसा है, या ये hard है? मतलब this is not hard. Neither is this. This is hard. So silesia के suppurations or hardness will be like this. ठीक है? The indurations are stony hard, slow processes, sluggishness. Discharges turn grass green. Now see the color over here. Silesia, we did not speak about the discharges. If at all there are discharges, there are serosanguinous discharges in silesia. In calcaria fluid, you have grass green colored discharges or thick yellow, lumpy and offensive discharges. And the pus is stinky. Glands enlarge and become stony hard. ये बहुत PQRS है. Then you will encounter long-lasting indolent glandular affection. Indolent मतलब ये आगे बढ़ नहीं रहा है. ये वैसे का वैसा ही पड़ा है. Then the next remedy you have phytolacca. Now what is phytolacca often used for? उसके पहले you need to understand that this remedy का elements from क्या है? As I have told earlier, we are going in sequence. So elements from will be exposure to cold and damp environment, any weather changes, and also abuse of mercury will be there. It's a remedy of long and deep action. मतलब you need not give frequent repetitions for this remedy. The remedy will be having sore, heartache all over and sudden. यहाँ पे again now the color of the part, the gland, it will be bluish, red parts, fosses and glands. If you have to see the buccal cavity, the glands over here, fossils will be bluish or red. Okay, spreading pains, and the individual will come up with rheumatism after tonsillitis. Now, glandular swellings with heat and inflammation is marked out over here. Pains come and go suddenly, and they change places. Now, यहाँ पे discharges are PQRS. This discharges stringy, shreddy, any discharge. It could be stool, it could be the glandular discharge, and they are difficult to detach. मतलब इसे तार की तरह बनेगा उसका, and may take form of clinkers. So you will encounter यहाँ पे right side affinity. Generally, the individual might be hot, preferably. यहाँ पे you will encounter swelling of the throat, swelling in the mammary, swelling in the axillary gland. Again with the same kind of presence. PQRS and tonsillitis would be the pains in throat are always better with cold drinks. Okay, right sided of the tonsils will be affected. Heart throbbing pains will be there. Patient will not be able to swallow anything. Stony hardness, however, will be there of left mammary. वहाँ पे right tonsil था, left mammary था. Stony hardness is there to the extent that when the baby sits for suckling the milk, the pain radiates everywhere. The breast is tumefied and neither heals nor suppurates. Is of a purple hue. Purple color, we spoke, bluish, reddish appearance of the fossils, right? So, ये color moves around indicating that the infection or spreading infective, the stage is advanced basically as compared to what you saw in Silesia, as compared to what you saw in Calcaria flu, right? Then we move ahead with the next drug, which is iodum, right? Iodum has elements from nervous shock, disappointment in love, anxiety when quiet. Anxiety is better when is hungry. Now, iodum, आपको elements में पता ही होगा, loses flesh when eating well. Remember this. This individual is hot, great debility, the slightest effort will induce perspiration and he loses flesh, as I told you, by eating well. So in this case, there is glandular hypertrophy except of the mammary, और कई बार glandular hypertrophy हो जाती है and then atrophy हो जाती है. This is what is seen in iodum. The person is worse with heat, any kind, better with cold. Okay, generally mentals अगर मिल जाते हैं तो the person has aversion to company and avoid sight of people also. ठीक है? Then we speak about the next drug, which is Konam. Konam again is a glandular remedy that we spoke like iodum and other drugs. However, यहाँ पे you move ahead with a cancerous diathesis. This drug will have elements from being alone, from masturbation, from sexual excess, climatic grief, sorrows, वगैरह. And this individual will have old looking expressions, cancerous diathesis, with no inclination for business or study, takes no interest in anything. Okay, enlargement of glands with little or no pain, which is PQRS with Konam, is usually for the beginning of cancerous, that is serous, and especially is indicated after injuries to the glands when stony hardness is present. Swelling of the glands are cold, hard, inflammatory, and painful swellings. Sensitiveness of the glands, especially right-sided affections, are noted, and you will also encounter that debilitated individuals are there with marked tendency to indurations of the glands will be seen, extending to cellular tissues. Atrophy of the glands, as I said, which was noted in iodum, will also be seen over here. Cancerous affection is there, right? And this individual is worse lying down, turning in the bed, celibacy, before and during menses, about the midnight, and better with fasting, pressure, sitting down, ascending, lying with head high. Right? So this is what was with Konam. Now we move ahead with one more drug, that is Moxol. Moxol is again a very commonly thought of drug, or rather you can say it is like a specific for all the glandular complaints, especially when you see the stage has advanced. Now we move ahead gradually, right? We saw Beladona, we saw Phytolacca, we saw Calcaria flu, we also saw other drugs like Silesia, we also saw drugs like Konam and iodum. Now we move ahead to a syphilitic tendency वाला drug. Syphilitic tendency वाला पहले हमने आप Konam देखा. Now we are seeing Moxol. So Moxol में आपको क्या दिखेगा? It follows usually they say Beladona. It is specific for any glandular affection, but यहाँ पे आपको PQRS का note down करना है. Apart from elements from जो यहाँ पे है from fright, suppressed foot sweat and suppressed gonorrhea, these individuals are volatile. मतलब जैसे thermometer की तरह immediately वो ऊपर नीचे उनका state होते रहता है. They are living thermometers, like. So basically they're introvert with very all the emotions hidden within and difficult to be expressed. These people are however very overreactive. So उनका pathology भी वैसे ही overreactive हो जाती है, but this will be with weakness. Syphilitic miasm, therefore all complaints will be aggravated in the night. You will have lymphatic glands which are enlarged, and especially the activity out over here will be of salivary glands and mucus glands out over here, typically. Offensiveness of the secretion, that could be breath, it could be saliva, it could be any discharges, it could be leukorrhea, it could be stools, it could be urine also. And the discharges, usually if they are glandular, they could be greenish in color, yellowish green in color. We spoke about calcaria flu, the discharges were greenish, the turning greenish, right? बाकी drugs में इतने discharging remedies नहीं मिले हमें. Silicea is also, yes, Silicea का serosanguinous discharge था. यहाँ पे जैसे in Silicea you also should be looking out for perspiration. Patient will be chilly but have perspiration especially around the head. बहुत ज़्यादा, right? Scalp में he's very sweaty. हाथ वगैरह भी sweat हो जाते हैं. Similarly, Moxol patients also are very sweaty. But the sweating is profuse without any kind of relief, and the stains will be there. यहाँ पे any kind of discharges, as I said, will be free, thin, slimy, acrid, foul, yellowish green, and offensive. Tongue, when it comes to Moxol selection, is again not given in any other drugs. Tongue के बारे में हमने कहीं नहीं बात की. But अगर glandular remedy आती है और tongue ऐसी वाली दिखती है तो definitely think about Moxol. The tongue will be large, flabby, moist, showing imprints of teeth मतलब ये side में, okay? Despite this moist tongue, the patient will have intense thirst, and the profuse salivation will be there. And this patient will be worse with cold, worse with warm, worse in the night, and better with lying down, and even worse with change of weather. So by and large, we have differentiated every remedy. I hope हर एक की features आपको थोड़े बहुत तो याद आ ही जाएंगे. अगर नहीं याद रहते हैं तो rewind play, right? You should know now. Rewind and play करके how you are going to again revise all the drugs, right? Finding it difficult? Go and download by clicking on the link below the drugs which I have given in short for lymph node enlargements. Hope this helps you. And if it has helped you, I think you should now share it with your friends also who will benefit. So this is for your exams. If you want to share, if you want to like, if you नहीं अच्छा लगा हो तो like तो करना ही है. Share it with friends, subscribe, and yes, there is a link below. Do click over there, download the app. You will get more updates to the activities that I'm doing. Okay, join the Telegram community also for further updates. Stay connected. We will make surgery more interesting so that you're able to see clinically how you can practice it. And I want you to go ahead and practice these drugs on any kind of lymphatic enlargements that you see. Okay? See you in the next video. Till then, like, share and subscribe. Bye.